Now, this is my most beautiful slide. This slide we published in January of last year. This is a very large study. Looked at initially close to 20,000 patients that were derived from the Truven Analytics claims database. And then we could cross-reference this with the Social Security Administration, and we're able to show the improvements in overall survival for patients with multiple myeloma. What you see in the blue curves in the bottom, those are patients with myeloma, and then they are segregated according to the year of diagnosis. And on the upper part of that graph, what you see is a control that is other individuals in that same database who don't have a diagnosis of myeloma. And what this really shows is a very quick fanning of the survival upwards, and with such impact that even within a few years, you can see the improvement in survival for our patients. I think this graph is important too because it continues to highlight the challenge that exists in the first 2 years after diagnosis for patients with myeloma, and a good number of them have high-risk disease, or some of them have other comorbidities. I also like to state that this is really a very neat way of doing some clinical research, what's called real world. This cannot completely replace randomized clinical trials, but it gets great power in the number of patients that can be studied, and in this particular case, it really shows that improvement in survival, and it's something that has been published in a similar way by others, including my colleagues at Mayo Clinic in Rochester. However, we know our job is not done. Myeloma is improving, but we're getting close to getting more durable treatments, perhaps treatments with lower toxicity, and we've already seen some of that. But as someone has said, we really are a cure away or combination away from being able to provide that definitive treatment for myeloma patients. And as my colleague, Dr. Paul Richardson would say, really the disease remains humbling.